Hi, Kevin Henry, the Group Editorial Director for Advanstar, Dental Products Report, and Modern Hygienist. And I'm on a Google Hangout today with America's dental hygienist, Anastasia Turchetta. Good morning, Anastasia.
Good morning, Kevin.
So we're going to talk today about something that's it's a taboo topic. It's in some places, and yet it's something that's very important to be discussing with your patients and to have knowledge about, and that is the link between oral sex and oral cancer and the HPV virus that you may have heard a lot about, but certainly it's something that it's a killer, and it's something that you need to know how to find and what to be watching for. And so, Anastasia, tell our viewers, I know you've been doing some research on the statistics about HPV, and just kind of give our viewers a brief overview of what you found.
Awesome, Kevin. Well, first of all, I agree with you. In some ways, many of us feel it's a taboo topic, yet I feel at the hygienist or dentist, any dental professional actually chairside, especially with April being Oral Cancer Awareness Month, HPV is a risk factor. So if you're going to discuss the risk factors for oral cancer, HPV is a risk factor. And why we're not addressing that, to me, that's not taboo. That's part of something that we should be looking for. Statistically wise, yes, it's an STD. 80 million Americans have it. So it can rid itself in about 1 to 2 years. Obviously, the younger that you are, our immune systems are healthier. So it can be dormant. Even if your body, let's just say, did not rid itself, it can be dormant in your body up to 20 to 30 years. So this isn't something that if you do get HPV, that you could say, oh, hey, I can track it back. Chances are you will never track it back to where you got it from. So that being said, I think that's a misconception, and that's something that we should share with our patients. The other thing is, how do you get it? We know that you get it via oral sex, and it's skin-to-skin contact. There are over 200 versions of this virus. We're concerned with the 16/18. That's more associated with cervical cancer, but that particular strain is what becomes active and destructive to our lives in the oral cavity.
So it's not a taboo topic. So how do you bring this up in the dental practice whenever you're doing an oral cancer exam?
Right.
Yeah, give me some education.
Well, it's not like you can sit around and go like, hey, do you come here often? I mean, it's just, you don't have that conversation. It's 5 o'clock somewhere. Really what you have to look at, and I think there's a lot of people who might be like, well, I'm uncomfortable in discussing that, is to share the statistics and to start the topic with, go through the risk factors and maybe go from the top, which would be cigarette smoking. How much alcohol do you drink? Is there a family history? Combine that, because when you talk about HPV, people are going to ask, oh, what is that? The human papillomavirus virus. It is associated with a sexually transmitted disease. That opens the gate up there. And then I do believe, obviously, we can't have conversations with our younger patients, yet those are the patients that are being targeted by Gardasil, appropriately so, because they're becoming active a lot sooner than what we became active, right? So start with the parents and have brochures around there. I mean, alarmingly, it's amazing how every day in the U.S., 12,000 people between the ages of 15 and 24 are infected with HPV. That's a high number. So why aren't we addressing that? Things to discuss with your patient, obviously, are where to look at. HPV positive in the oral cavity is going to be more towards the back of your throat. Usually if you're cigarette smoking, alcohol, UV, family history, it might be towards the front of your mouth. So when you're doing the oral cancer screening, and I encourage saying that, make sure that you extend the tongue out and that you have them say, ah, so we can see anything going on in the soft palate and as it starts to go down the throat. That's where HPV is going to be found. Now, on a positive side, though, HPV positive patients, once we find that cancer, the good news is they respond better to treatment. That's the thing that I think people really need to hear, because once you find it and it's not HPV related, those statistics, it's not good, Kevin. You have maybe a 5-year, 57 chance of survival. I don't like those statistics. I don't know about you.
No, and as dental professionals, I mean, no one should like those statistics, and hopefully that's even more of a reason to start that oral cancer screening process and the education, even though it may be uncomfortable. It's still
Exactly.
just hearing that right there is a great reason to get off the bench and start doing this.
Right. It doesn't make it taboo anymore. What it does make it is something that we gave an oath to when we started our careers, and to make this a every visit have it. So if you've got the technology or if you don't, it is important to have this discussion and screening at least once a year.
It's a great point. And last question I'm going to ask you is, dentists, hygienists, assistants, everybody's going to be watching this video because I think it's definitely a hot topic and it's definitely something that people are interested in learning more about. Does the role of the dental professional, whether it's a dentist, hygienist, assistant, how does that change as far as the oral cancer screening and even the education process? Because really everybody plays a role in this, right?
Everybody plays a role, and I feel that it doesn't. I mean, we really need to educate the entire team. So if somebody calls up to ask, because let's just say a lot more people are getting on social media now, which is awesome. We've got Jim Kelly in the news. We had, there's been a lot of celebrities who have come out with oral cancer, whether it be HPV related or not. But we've got patients who are going to ask questions, and they're going to see it on social media. So I say be prepared and educate your team so the language is consistent. That's the key. It doesn't matter what you do or what your protocol is. That's the doctor's choice and vision. But please educate your team and make that language consistent. So no matter who calls, no matter who the patient is, we can answer that with the best answer that fits them.
Great advice as always, Anastasia. Really appreciate your time, and thanks for tackling a taboo topic with me today.
Thanks for having me, Kevin.